When someone's blood flow or breathing stops, seconds count. Permanent brain damage or death can happen quickly, and if you know how to perform cardiopulmonary resuscitation, you could save a life. Cardiopulmonary resuscitation is an emergency procedure for a person whose heart has stopped or is no longer breathing, and it can maintain circulation and breathing until emergency medical help arrives. Even if you haven't had training, you can do hands-only cardiopulmonary resuscitation for a teen or adult whose heart has stopped beating. Hands-only. CPR isn't recommended for children. Hands-only cardiopulmonary resuscitation uses chest compressions to keep blood circulating until emergency help arrives. If you have had training, you can use chest compressions, clear the airway, and do rescue breathing. Rescue breathing helps get oxygen to the lungs for a person who has stopped breathing, and to keep your skills up, you should repeat the training every 2 years.